We're going to get started this morning a little bit live. Beamer. So I hope the breakout sessions were helpful. We added those last meeting. I think they were well received. I think it's nice to kind of get down to the more nitty-gritty of some specialties. So I hope it was helpful. And I'm going to send out some surveys as far as what worked and what didn't work for this alumni meeting. So next time it's even better. So please keep an eye on those. I have also been recording all these talks, and I'm creating a YouTube channel for it. So if you guys want to come back and see the talks, they'll be all recorded. We have a special raffle after this talk. We're going to raffle off a 20-minute signed basketball. So stick around for that. But without further ado, the general session will start now. But this is Beamer Carr. Beamer Carr was a resident here at UVA. When did you graduate? 2018? 2018. 2018. Yeah. And just he came through and was just like the kind of guy you look for when you're trying to recruit a resident to a program. Just engaged, just every single day brought it. One of the favorite residents we've had here in a long time. And he's been trying to build his practice in the past 4 years. He went to HSS for his sports fellowship, and then actually stuck around with HSS and has joined their practice out in Florida. And he's building a practice. And I thought it'd be really good, especially for our young alumni and for our residents and trainees in the room, to kind of get a sense of how like he kind of got his practice up and running. So Beamer's actually done, he did ICL, the OSSM last year, at the sports meeting that was really well received about, lessons learned early in practice. And it was such a great talk. I thought it'd be really great for this group too. And so Beamer Carr, again, thank you so much for being here, and the floor is yours.
Thank you. Thank you, Winston, and everyone for having me here. It really is an honor to come back and just kind of share what life has been like post UVA, because there is a life after UVA. I know it doesn't seem like that when you're in the thralls of residency, but it comes at you fast, and there's a lot of things I've learned and wish I would have learned that I would have loved to have known. So hopefully this can be helpful. I do not have any disclosures. I'm currently in the market for them, so maybe I need to hang out in the lobby out there. So the first lesson is feel free to pursue disclosures tactfully sooner than I have. So that's one thing. Although I do have one thing to disclose. I am an alumni of Furman University. I played baseball there. Dr. Chilver's already shaking his head. So I do want to say thank you for putting my alma mater on the map, because before this March, no one knew where Furman was, and now at least most people do. I know this really hurts Dr. Chalmers and Dr. Dudek's heart, but this is probably better than when I was a chief resident and put these kind of pictures in my fracture conference talk. So we'll just kind of keep moving before I get removed. Yeah. So moving on. So yeah, exactly. It's been great. Have a great time. Yeah.
Yeah, Dr. just said the next talk should be how to give a talk.
How to give a talk, yeah, exactly. So, know your audience, yeah. So moving on. So I just want this is kind of like our med school, medical journey in a nutshell here. So everybody gets into med school. You're super happy. You're like, yay, we're in med school. It's gonna be great. And then you realize it's really just studying a lot, and it's not as glamorous as you thought. But you graduate, and then you're happy again. So then we all show up to residency. It's intern year. You're wearing a real white coat. You're a real doctor in your mind. This is going to be awesome. I'm going to be calling the shots. And then you realize residency is really more like sleeping in the back of the OR at 3 a.m., waiting for your fourth epidural abscess case to go with Dr. Shen in PGY 2 years. So you're like, this is kind of rough. But you survive and you get through. So you're happy again, and everything's great. So you're done with residency. Now you're ready to conquer the world. So you show up to fellowship. Again, you're an excited doctor. This is awesome. It's going to be the best year ever. And it kind of is the best year ever. It's like the Great Gatsby. You're, mooching off of these amazing practices that your mentors have built. You're going to these swanky parties and conferences. It's awesome. You love it. So then you graduate. You're happy. So now after fellowship, you're like, all right, I've finally paid my dues. I'm ready to receive all that's coming my way. You show up your first couple years of practice. You're ready. You feel good. And then boom, the first couple of years just hits you, just like this, running back or wide receiver. And you kind of get blindsided and really kind of get knocked to the ground a little bit and have to regroup and figure out what you're really made of. And you're kind of like this meme where you're just sitting in a big fire, just trying to convince yourself everything's fine. So, everyone's asking, how's the first couple of years of practice? You're like, it's great, don't worry. But really it's like a big fire going around you, and you're just trying to figure out, how am I going to put it out? How am I going to survive? How am I going to, make this what I want it to be? And so that's really kind of the point of this talk, is that the early years of practice, they're generally regarded as the most stressful, potentially least enjoyable years of clinical practice. And while this is generally known, not much is done to actually, prepare people in the process of how to, how to be ready for that, challenging time. So what advice did I give for my mentors as I was embarking on starting my own practice? Make sure you irrigate your wounds. I was told that the first 5 years of practice are the worst 5 years of your life. Good luck. I was told, oh, you'll be fine. You're a good guy. Don't worry. You're a good doctor. You're a good fellow. You operate well. You're a good resident. You're fine. You'll figure it out. And then I was told, just don't kill anyone. So that was kind of the advice I had. Unfortunately, none of this really prepared me for what was coming my way. And so there's really a paradox of those first couple of years. The paradox is that we're the least prepared at any point in our career with the least amount of experience. Yet it's really still upon us to give patients the highest level of care. And so, you may go months without doing an ACL or whatever surgery. You get done with residency in July, you don't start work till September. It might take a couple months till you actually start seeing a patient that you may operate on. And next thing you know, it's November, you're doing your first Tommy John or UCL or, big hand surgery or spine surgery or whatever the case may be. And it's been 4 or 5 months since you've really actually done that on a real person in any capacity. And it's hard and it's very stressful. To make things worse, as we've heard before, what you don't know, the things that you don't know is what really hurts you the most. That's what I always told our junior residents when we were taking 1206 call. It's what you don't know that hurts you the most, and that still applies even when you're in attending. And so really, my goal is to try to bridge that gap and try to create that bridge to help trainees be a little bit more prepared and kind of know what's coming on. So I don't know if the video is going to play, but this was kind of the general reaction that I got when I started.
Nice. Great. Gee, I can't wait till I go to high school. As long as you can. For the love of God, cherish.
So as you know, that's Billy Madison, where he has to repeat every grade to take over his father's company. And he loved 3rd and 4th grade. And when he got to high school, he realized it wasn't as fun as he remembered it being. So when the 4th grader's like, I can't wait till I get to high school, he's like, cherish it. So I kind of felt like that when I was a fellow. I can't wait to start my own practice. And I felt like all the attendings would just grab me by the face and just cherish being a fellow. Like, you don't understand how stressful it is. So I just thought they were being, a little over the top, but it turns out there was a lot of truth in it. So real briefly, I just want to give a brief overview of my journey and really focus on some of these lessons that I've learned. So the training years with residency, this is my PGY classes, PGY2, our last night of PGY2 call. We all took it together just to kind of celebrate being done. But the biggest question you have to ask yourself is, what do you want to become and what are your goals? And it's really never too soon to start asking that. My answer was I wanted to be a very high-level baseball surgeon. That was my passion. I played baseball. I really wanted to do that. But when I told that to various, co-residents or fellows or, just other people, a lot of people say, oh, that's too hard to do. There aren't really enough Tommy Johns to go around. Have you considered doing hip scopes? It's easier to get your foot in the door that way. And that wasn't just Winston. That was a lot of people that would say that because, hey, it's a lot easier. No one's looking for a Tommy John guy. Just go do something else, go do other things. And then as my chief here, Dr. Dacus and the program sent myself and Ian Dempsey to the AOA Residency Leadership Forum. And it's there that I met Bill Matsouris. And I doubt he really knew he had an impact, but I was talking to him about it. And I was like, I'm thinking about maybe doing hip scopes, trying to get my foot in the door. And he's like, well, do you like hip scopes? And I said, no. So why would you do that? If you know what you want to do, then go for it. If it may take you longer, it may be harder, but there is a way and you can do it. And so that was really a big lesson, is that you want to set your goals and then set yourself up to reach those goals. And the beauty of it is that UVA residency is the absolute perfect place to help you do that. You have amazing mentors and faculty in every subspecialty. And so I didn't realize when I first got here just how blessed I was that no matter which way I wanted to go, I was going to have some amazing advocates and amazing mentors. And so for the residents, you have all the resources you need here to be successful and to get to wherever you want to go. Take advantage of that. That's why you're here. And the people here are passionate, as we've seen this week, to help residents get there and fellows as well. So for me, I needed a fellowship with the best baseball medicine experience possible. So enter HSS, and that's really where I really got a full, kind of year of really just diving in with the New York Mets under the mentorship of David Alchek, and he really has become a life mentor and a career mentor. And I basically told myself, well, if I want to be like that, I need to go do a fellowship with someone who's already done that, and I need to pursue that. So that was really a big changing time. But then the first year of practice comes. And, just give you a brief overview. I finished my fellowship. I start first clinic day at HSS New York. I was recruited out of fellowship to take over their Florida branch from a sports standpoint, stay on staff with the Mets, kind of head up the minor league side of things. Sounded great, but the building wasn't ready in time. So unlike this place, ours was not built on time. So I started clinic at HSS New York. I did a little sponsored traveling fellowship, which was great. Definitely recommend that to the trainees if you get that opportunity. Try to go beyond fellowship and residency, meet some of the mentors in the field. And that way, when you go to meetings and of the subspecialty, they're your friends or your colleagues. They're not just some big giant that you're intimidated by. So that was a really big thing for me that I've been able to have. Eventually moved to Florida, started practice. I was officially on staff with the Mets, but then we got shut down for COVID. So everything shut down. It eventually reopened. And my big lesson is try not to begin a practice during a global pandemic. Not the best time to do it. But the rest of my early year journey, year two, things got a little better, still pretty slow, only doing about 13 cases a month. Still on staff with the Mets. We had our first child, JB. He's 2 now, but that was definitely a huge highlight. Became the head team physician for a local NAIA school, which was great to, stay involved with local sports coverage, continue doing research, increase networking. Year 3, jumped to about 20 cases a month, still on staff with the Mets, performed double-digit Tommy John surgeries, which was a good goal for myself, including the first on a professional pitcher, and then led our first ICL at AOSSM. So really trying to grow it within the field, and then first podium talk at the MLB winter meetings. This past year, continue to grow, still kind of stuck at 20 cases a month, which isn't a ton for someone who's in their 4th year. There's been a lot of challenges there that I'll talk about. But from a baseball standpoint, it's been going really well. Still on staff with the Mets, now a surgical consultant with the Miami Marlins. Their local guy left town. So I was able to step in and be asked to fill in that role. I was able to cover the World Baseball Classic down in Miami. Again, kind of right place, right time, and able to benefit from some of the relationships I'd made. Increased networking, but it still takes a really long time, as I'll show on this next slide, to really build what you want. Even though the baseball side of things is going well, it's a very small piece of what I do, and the other bigger piece has been kind of fraught with frustration. So if we look at the negatives, it's still a pretty low surgical volume. I see about 35 patients in clinic, not uncommon to book anywhere from 0 to 2 surgeries a day. This past Monday, I had what I call a shutout, see 35, don't book any cases. Really hard to be 4 years in and as Dr. Yarborough will say, just passing out ham sandwiches. There's a lot of PT scripts, a lot of, pats on the backs and, hey, go get him. Your knee's going to feel better playing pickleball. Don't worry, or maybe like playing pickleball 7 days a week at the age of 80 is not the best, life choice. But, my average age, has been too high. If you look at my initial patient age, it's still hovering around 60, 65. That's a far cry from the specialized sports practice that, my mentors here and in fellowship have. And, trying to work to get that down, but it takes a lot of work and a lot of effort to do that. Still not on a major insurance. Florida Blue Cross is about 30% of the population. So there's a big access to barrier to get to our group, which has been a struggle. Practice flow is fairly inefficient. A lot of staff turnover. So it's really hard to find good help, especially post-COVID. We've had 3 different presidents for our group, so 3 different leaderships. I've had 3 different MAs, 4 different admins for my clinic. So it's hard to get consistency with scheduling when you're constantly trying to retrain someone. And then countless different scrub techs, OR nurses. So every couple of months, it feels like you're doing the case for the first time because you're doing it with someone who's never done it before. So it's very stressful to have to do that. Took 3 years to get/earn a PA. That was something that Dr. Chopper and everyone would say, oh, you're not just going to walk in and have a PA and have scribes and have all that stuff. And it's true. It took me 3 years to get to that point. I really wish I was kind of teaching a little bit more residence fellows. I always envision myself doing more of that. I hope that can evolve in my career as I go on, but that's something that's tough. And, the cost of living where we live is still very high. So we're still renting. But there are a lot of positives. We're 10 minutes from the beach. I have an almost purely sports practice, unparalleled baseball experience, which is what I really want to pursue. Amazing opportunities and continued mentorship, both from fellowship and residency mentors. I'm the only sports surgeon in the group, so that definitely helps. And I'm finally becoming a little bit more comfortable with my techniques and kind of conquering that learning curve. And there are a lot of research opportunities. So I think every job you have, you're going to have to kind of weigh out the negatives and positives. And really, if there's a summary, is that there's no free lunches, and you win some, you lose some. I kind of thought being at HSS, having that name, having the mentors I had from residency and fellowship, it would kind of blunt my acceleration curve for my practice. But it's still a very long, steep curve that you just have to ride the wave, and it's been very hard to do that at times. You'll always have negatives. You'll always, hopefully have positives. And I think the big lesson for this part is you will have to compromise, certain things with your job, and you just need to ask yourself, do the positives outweigh the negatives? So for me, the baseball side of things is very hard to build, and I've been able to luckily have some great opportunities. So in that sense, those positives do outweigh some of those negatives. But you really have to kind of ask yourself, what do you want out of your job, and make sure you're at least getting that. And I think that should be a good litmus test on whether or not it's a good fit, at least initially. So now these are the lessons I've learned. So a lot of lessons from UVA. So Mark Miller told me that it's hard to reassure a patient if you're not sure yourself. And that's probably the hardest thing, is even though you've seen injuries in residency and fellowship, is different when you're the one telling the patient how long it's going to take for them to get better. And if you haven't seen that personally and followed it and have that longitudinal timeline with a patient, it's really hard to reassure them. And patients sense that, and it's a struggle. Prioritize your family above your job is very important. It's easy to get trapped into the stress of the job. Research can actually be a lot of fun. Werner taught me that. You never rotate off your own service. Frank Shen was very adamant about that, and he's right. And you never do. So it's very sobering sometimes. And sometimes you really wish you could just, trade your service in for a little bit more. Call your patients the day after surgery. Gwathmey and Park really taught me that, amongst others here at UVA. It really is important. Be prepared to lose some sleep. When Scheimer and others would say this, I was like, oh, come on. That's like, he just worries a lot. I'm not going to be like that. But again, once you realize the actual amount of responsibility you have, you realize, gosh, there's things that just, they weigh on your mind. And it's hard to leave it at the office when your patients are struggling or you're struggling. When you're doing a tough case for the first time, do it with a colleague. I think that's really helpful when you're starting out. Incentivize your office staff. So really trying to build that team and incentivize them. And, whether it's, getting them lunch, if you hit a certain goal or whatnot, can be really helpful. PT never killed anyone. So if you're ever in doubt, PT usually isn't a bad way to start. It takes time to build a practice on good word of mouth, but that's the best way to do it. So that's from Dan Cooper, the head doc for the Cowboys. I spent time with him after fellowship. And this was a text message I sent to him, after my first day at clinic. And he basically just said, hey, let them ripen on the vine with conservative treatment. The ones who need surgery mature, the ones who don't still sing your praises for not having a quick trigger. And, you'll probably get as many patient referrals from that patient you never touch with a knife as you would, someone you operate on. So never underestimate the power of just being a good doctor and a good person and taking good care of patients. If a patient is having a complication, see him or her twice as often. I know Bob Arciero said that a lot at a visiting professorship when I was a resident, and many others here have said that. I think that's really important, not running from those complications. And then Russ Warren basically said, if I only did the surgeries I felt completely comfortable with during my first year of practice, I don't think I would have done many surgeries. So that you will be stretched a little bit from your comfort zone, and don't be afraid to step out. These are the I told you so lessons that were right, that I wish weren't right, but they really were. You won't have the practice of your residency and fellowship mentors right away. That takes decades to build. So I remember Dr. Chauber saying that many times and thinking, yeah, maybe not. I don't know. Probably just depends, but he's 100% right. It actually is really hard to build that, and your practice will not look like your mentors, at least initially. It takes a long time to do that. Don't assume your surgical team knows how to do things the way, quote, you like to do them. Dr. Weiss and others would always say that, and he's exactly right. When you show up to your job the first day, you'll realize there's, blunt tip guide wires that you didn't even know, because where you did training, they always use the sharp one, and then they pass you the blunt tip one, and you're like, oh, it's a lot harder to put the blunt tip in than the sharp tip. Do you have the sharp ones? No, we didn't know you liked them. Oh, I didn't even know there were blunt ones. Okay, well, I guess I have to find a way to use this blunt tip guide wire to get my interference screw in. And you're very stressed because it's your first ACL, and it's just really hard to, there's so much that goes into being successful, and it's just hard to know all that when you start. It's a lot harder operating without another attending around. Even their silence is reassuring, because if you were doing something drastically wrong, they would speak up. And not having that agreeable silence or correction is a little intimidating to not have that. You rarely end up with the same team as you start with when you start off, so it's really hard to manage that turnover. And it turns out it actually is a lot more stressful being an attending than a trainee. So I remember all the attendings in residency, fellowship, saying how much more stressful it was to be an attending. And I'm thinking, well, come on, you're not there at 4 a.m. rounding on spine patients and there till 10 in the trauma room. Like this is super stressful. And it's true, residency is very stressful, but it's a different kind of stress. I was talking with Dr. Tom Brown last night of just, how right he was that when it's all on you and you're the one that's accountable at the end of the day and the buck stops with you, that's a totally different stress that you don't deal with. So I remember at M&M as a resident hearing about some really tough complications, and some of the cases I was involved with, some not. But at the end of the day, you go home and you're not the one that did that to that patient, or had that happen to the patient while they were under your care. But when you are the one that has that, it is hard, and that's where you really need to have those mentors to fall back on, like Dr. Chhabra talked about yesterday, and we'll talk about that a little bit at the end. These are some other lessons I've learned myself. Take extra time with patients in clinic, especially when you start out. You'll have the extra time. When you see 8 patients a day, you can spend 30 or 40 minutes with them. You might as well, and then start building that good reputation. Stick to good indications. Don't let the fact that you're not busy allow you to bend your indications. A chance to cut is a chance to cure, but there's nothing surgery can't make worse. So even benign, innocuous little surgeries might go bad with the rehab or whatnot. So make sure if you're taking a patient to the OR, you're doing it for the right reasons. Never force or convince a patient to have surgery with you. So there'll be older, more mature surgeons in your group, in your town. Never try to convince a patient. They should trust you and want to have surgery with you. It will take you longer to do a procedure than you think, so schedule your day accordingly. You will struggle in the OR, but don't let that struggle prevent you from achieving perfection. As Ted Schuler down in Roanoke would say, avoid performing a surgery with, quote, signs of desperation. So, sometimes you see those post-op x-rays, and you can just kind of put the story together in your mind of, how the surgeon got there and the surgeons didn't come out well, and it was not a good reduction, and implant wasn't right, and then they didn't have the right implant. They're trying to do other things. You just kind of piece the story together. You really want to just, take a deep breath. That fog of war is really true when you're a young attending, to just, something doesn't quite go your way, or you break a pin, or you do something, and then now you're getting nervous, and you're lucky you have your brown scrubs on, and you're like, what am I going to do? Just, take a deep breath, think about what your mentors would do, and still try to hit the mark with your surgery. Be careful about relying on others so you can trust them to do it your way. I hired a new PA about a year ago. She's great. She's very experienced, but I kind of gave her a little bit more autonomy with closing my wounds before I really I just assumed, yeah, she's been doing it for like 5 years. She does a great job. She knows what she's doing. She makes a great ACL graft. She's probably great at closing wounds. That summer I had 4 or 5 wound dehiscence and basically spent my whole summer washing out pus, and it was miserable. And I don't blame her per se. I take full responsibility for that because I wasn't the one. It's my responsibility to make sure that the wounds are being closed the way I know they need to be closed. And I didn't do that. So it was really hard to know that my oversight there led to some bad outcomes. And it was very humbling to have to experience that. Get on the major insurance plans ASAP, and then take some time off if you can before you start. It's really invaluable, because once you start and get on that hamster wheel, it's really hard to get off and take a pause. So, if you can take a week or 2, take some time with your family or whoever's important with you, then that's really great. Kind of rounding the corner here, some other advice, just kind of direct a little bit to the residents and fellows. Make sure you make your practice what you want it to be. It will not become what you want it to be on your own. It won't become what you want it to be because you're with a certain group or because you did a certain fellowship. Where I'm at, I don't think any of the population other than the snowbirds know what HSS is. They'd probably be more impressed if it was UVA or some other notable name that they've heard of. They don't know what HSS is. So I have to be the one to go out there and try to make it what I want it to be. Create 1, 3, 5, and 10-year goals for your practice. And I always, at the Mets Minor League Center, we have a sign that says direction is more important than speed. And I think that's really important when you're starting out, is direction is more important than speed. So you have to ask yourself, what are my goals? What's my direction? And as long as you're going in that direction, I think you're on the right track. Even if it's going really slow, as long as you're on the right direction, I think it's more important than the speed at which you're going. I certainly have a lot of co-fellows that have much busier, highly specialized practices than what I have, but they have different priorities and different goals, and I have to remind myself of that. Come up with a tangible plan for how you're going to reach those goals, and then you have to build and groom your practice. So don't just build for the sake of building. Keep your goals in mind. So everyone's practice kind of looks like this when it starts. The goal is to get like a nice, happy, Bobby Chhabra, Dave Diduck, type practice that looks like that. Because the problem is when you start, you ask your groomer and you think this is what you're going to get, but really what you get is that right there. So like what you think you're getting versus like what you actually get is very different when you start practice. So you really have to be specific and go for it. So real quickly, how to build and groom. I think you need to focus more on building, but don't forget about grooming. I recommend thinking about your patients in 3 categories. One is the cases you love and want to be a part of your practice. So you say, I want to be the insert whatever, surgeon. Really aggressively, pursue those. Category 2 are cases you like, you're skilled to do, you don't mind doing them, but at some point, you wouldn't mind dropping or weaning back on those cases. Those are the ones you're going to start doing initially, but over time, as you build up your practice, you can start maybe dropping. And part 3 are the ones you either hate or just don't feel like you're skilled to do. And those are the ones that you need to be mindful of as well. My personal advice is to aggressively pursue referral patterns for the category 1 patients. Initially pursue category 2, but kind of groom along the way as your practice grows. And then minimize and avoid category 3 as much as reasonably possible. You might still have to do some of those, but try to minimize them if you can. You need to ask yourself who are the gatekeepers for those patients, and then that's your networking target. You need to understand the referral ecosystem of where you're at. So when you're not busy your first couple of months, go out and meet the PT groups, go out and meet the ATCs, go out and meet the primary care specialists, whoever's the gatekeeper, the physiatrist, whoever are the gatekeepers of the patients you want to see, go meet them in person, use that extra time wisely. PCPs are good referral sources, often for the patients over the age of 40. For the younger patients, usually the PTs and the ATCs, and you have to kind of understand the relationships of who controls the ATCs for the high schools, for the other areas. And you really just need to kind of understand those things. ATCs, again, tend to be a really major gateway, but you need to know who their boss is and also understand that. Other ortho surgeons, so I've had a lot of success just meeting other young ortho surgeons that have complementary practices. So they don't want to do Tommy Johns, but I love Tommy Johns. I don't want to do hip scopes, and they love hip scopes. So we can trade and pass off and do that, which has been a very great, mutually beneficial relationship. Sports performance gyms, specialized sports academies, very well connected. And even, going off the beaten path, chiropractors and other people nowadays, a lot of people will see a chiropractor or someone else first because, that's who they kind of initially see. And so they're probably already seeing the patients you want to see. So you might as well, try to make some good inroads there. Don't forget the Andrews A's. We all know those: availability, affability, and ability in that order. You must have very good access and make yourself accessible. Make sure all the PTs, coaches, they have your personal cell number or direct number. So I call the ATC after every patient encounter. So, if I'm seeing a Mets minor league player, I'm calling, the trainer of his team, the head of minor league rehabilitation, you name it. So on the way home, I'm basically calling ATCs, PTs, GMs, whoever, my whole way home, to update them on the patient encounters. They love the follow-up, and it's how you really build that trust. Never turn a patient away from your clinic. The answer is always yes. I'm happy to see that patient. You'll be surprised what referrals you can get from even someone that is something you don't want to see, or a condition, you wouldn't necessarily offer a surgery for in your hands. Communicate back with the referring provider. PCPs love that. It's a great, care for your patient. And your goal is really to get on the short list wherever you're at. And it takes a long time to get on that short list. So lastly, for building and grooming, again, your answer should be yes for clinical opportunities, but they don't have to be yes for things outside of clinical opportunities. Your time is your greatest asset, and it's probably the only thing you have complete control over. So you just really have to be careful how you're allocating that, because you can get down a bad path, getting too wrapped up in things. You're no longer a trainee, you're building your own practice. So really choose your blocks wisely. So there's a lot of blocks. You can make them look like a lot of different things. The question you have to ask yourself are, what blocks do I have, and what do I want my blocks to look like? And you need to start building accordingly. And just because, someone else is building a house doesn't mean you can't build whatever that is or whatever that is. So as long as you like it, then that's great. So debunking, just one slide on debunking a few myths just to think about. These are some myths that I think I was taught as dogma throughout my training, but I found them for me not to be true. One is taking call is a great way to build your practice. My take is that taking call will build your overall practice. It will make you busier, and you should definitely take call and, should do it. And you almost certainly will have to. But depending on what your goals are, it may not be the most efficient way to build exactly what you want, depending on your subspecialty. So if you if you're in a subspecialty that has a lot of injuries that go along with call, then great. It's a great way. Some of my sports partners get a lot of multi-legs, taking call and things like that. Where I'm at, we take call at a level 2, center that is in a very low socioeconomic status, part of the state. It's great. I love taking care of those patients, but it's not going to build a sports practice. So I just have to know that and not rely on the call to actually build up a sports practice. It doesn't mean I don't like doing it or won't do it or don't have fun doing it and doing trauma. It just means I don't rely on that to build the, sports practice that, I'm trying to get to. Patients will want to see you because of your group hospital's reputation. That's partly true. But I really think patients want to see you because of your reputation, and that takes a lot of time to build. A lot of patients, though, they don't ask, where should I get my rotator cuff fixed? A lot of patients ask, who should fix my rotator cuff? And it takes time to get on that short list like we talked about. Your hospital and practice can definitely help you build depending on where you're at, but it doesn't always. So I have a lot of co-fellows that showed up and joined a well-established practice and realized, wow, they're not doing anything to help me get busy. And it's a very big eye-opener for them. Some places do. They do a great job. So you just have to be ready for that. because I kind of thought this was going to be true for me. Like, oh, we're HSS, so definitely want to come here. Turns out that's not the case. So at least in South Florida. So lastly, some final advice before we have time for Q&A. You'll be humbled a lot throughout your early years of practice. I think that's probably the number one thing I've learned, is just how humbling it is to be your own physician. You'll be humbled by how long it takes you to do something in the OR that your mentor took 2 minutes to do. You'll be humbled by the nuances of injuries you've never seen before. You think, how could I do 5 years of residency, 1 year of fellowship, and still see this kind of injury that has this nuance to it that I've never seen, and how should that dictate the care accordingly? You'll be humbled when your patients have complications. You'll be humbled when you make the wrong decision. You'll be humbled by the success of your patients when they come back and do really well, and you're proud of how they're doing. You'll be humbled by how much they trust you, as Dr. Abel talked about, and just how humbling it is to have that trust from the patient. I think, in my opinion, there's no more greater sign of that when a patient does have a complication and they come back to you and trust you to deal with it. I think that's a really good sign that you've built that relationship along the way. And I think that's probably the most humbling position to be in as a physician. Make sure you have mentors who will share in those highs and lows of your first few years. It's very easy. My college baseball coach, he always said, you need to have some good teammates. So he would say, when things are going great and you hit the walk-off home run, it's easy to be a good teammate. It's easy to go and jump around and pat on the guy's back and to receive that. It's a lot harder to be a good teammate when you give up the game-winning home run, when the ball goes between your legs and you lose the game because of it, when you strike out with the bases loaded and the tying runner on third. He's like, that's when you need a good teammate. You don't need teammates when you hit the walk-off home run. Sure, it's fun when you have that, but you really need that teammate when you struck out, and you need someone to pick you up. And so you need to make sure you have some good teammates that can share in both of those. So when you do your first case, you can text your mentor and share in that. But when you're having those low times, you want to have mentors you can reach out to. Like I said, this past summer and fall, it was a very difficult time for myself, my practice, my family. I was traveling a lot with the MLB draft and AOSSM and getting board certified and all that kind of stuff. So I wasn't home as much as I needed to be. My wife had a miscarriage, and that was really hard because the day we found out she was having it, I was at the OB-GYN appointment, and then I was scheduled to be in clinic the rest of the day because I was gone for so much. And my office staff was already about to kill me because I'd missed so much time, and we're cramming in patients when we can. I probably should have called off clinic that afternoon, but her parents were there, and I went back and worked that afternoon. And I don't think I made that right decision. It was really hard. I didn't really talk to a lot of people about it. That was when I was washing out 4 or 5 wounds of just, drowning in pus, and really did not like my practice. And then to top it all off, I had an axillary artery injury on a subacute open subscap repair. That was just an awful complication to have to deal with. And the patient's, doing okay. But that was really hard, and I was really embarrassed, and I was afraid to reach out to mentors because I was like, man, I'm supposed to be this well-trained, good surgeon. I don't want to make UVA embarrassed. I don't want to make HSS embarrassed. I don't want, Dave Alchek to be disappointed in me. I don't want Dave Diduck or Bobby Schaber or Winston Gwathmey or David Weiss to be upset at me that I, messed up. And so I really wanted to hide, but I was really lucky that I had some really good mentors. Brian Kelly called me, talked through things with me. Russ Warren called me, talked through things. I talked with a lot of my colleagues, a lot of my partners at the group, that I'm in, and talking through it with them really helped me understand that we all have those patients, we all have those moments. And it taught me not to ever, judge anyone in their complications, because I was, sitting there feeling like I was just the worst surgeon in the world. I was a fraud. And it was really hard to have that happen in my 3rd year of practice, to have that kind of that time. I don't think I was really ready for that. So I'm very lucky that I've had some great mentors both here and through my career that I could lean on. And I would just encourage the trainees, when you're going to find yourself in a season like that, where you just want to walk away, and it's very appealing to do so. But I always kind of fall back on what my college baseball coach said. He said, you're not defined by the scoreboard. So if we blew a team out, he'd always say, when you win 10-0, you're probably not 10-0 good. You're good, but you're probably not that good. When you get blown out 10-0, you're probably not that bad. So he's like, when you get blown out, you're not as bad as the scoreboard says you are. When you blow out the other team, you're not as good as the scoreboard says you are. So I really had to fall back on that because I felt like I was down 100-0, last summer and fall. And that's what the scoreboard was kind of telling me. And I was really lucky to have some good mentors that could kind of pull me up and remind me why I became a doctor, why I pursued, the field I did, and why the scoreboard doesn't define, who I am. And so in closing, you're on the verge of the most rewarding and challenging time of your medical career. Don't be afraid to lean on your mentors. That's why they're your mentors, as Dr. Chhabra taught us yesterday. Above all else, do enjoy the journey and be ready to learn a lot. And you will be humbled by how you can unexpectedly impact someone's life. So this was a letter I got from a patient probably 2 months into practice. He was nearing 90 years old. He had a failed quad repair. It was still somewhat functional, but not doing great. He could walk fine with a cane. He was really mulling if he should do a revision to try to, improve it. And I really just talked about risk, benefits, et cetera. And, he essentially just said, after much soul searching, I've decided not to go through with another surgery. Nothing in my decision reflects on any lack of confidence in your ability to appropriately perform it. He basically said, it's influenced by my growing realization that I'm well on my way to turning 90. I know that I have to work on acceptance. One of the pluses of this experience was the opportunity to get to meet you. You made it clear to me that there are good young people out there that will take care of this world. And that was a patient I never touched with a knife. But I keep that letter pinned on my office so I can look at it. So when, the scoreboard says I'm not that good, I can look back and say, it doesn't matter what the scoreboard says because we're here to impact people's lives. And that's why we show up to work, is to have the opportunity to impact lives like that. I also always like to give, as the last word to my dad. He was an orthopedic trauma surgeon, passed away when I was a third-year med student unexpectedly. And he was really the main reason why I am here today, and why I chose orthopedics. And the day before he passed away, he told me that no matter how much medicine changes, at the end of the day, it boils down to me and the patient in the room. I love serving my patients. Nothing can take that away from me. If you have this perspective, you never have to work a day in your life. And so, when you're in the trenches of the first couple of years and things just don't seem like they're that much fun, because a lot of times they're not, hopefully we can all kind of fall back on wisdom and advice like this from, our mentors to kind of give us that motivation to keep going. And so I always like to say, keep chasing your dreams, because one day you just might catch them. I think that's the most fun part about the first couple of years of practice, is you get to start chasing your dreams, whatever that may look like for you. I definitely haven't caught all my dreams yet. I have a long ways to go, but I'm really enjoying the fun that it is to chase them. And I'm extremely indebted to UVA and just the amazing, just the amazing training and just life skills they taught me throughout residency and beyond, to be able to chase my dreams. The only reason I can chase my dreams today is because of the people here. I came here as a med student and didn't know much about UVA. I just knew it was a great program, and I had no idea how it was going to transform and impact my life, my career, and who I am as a man. And I just can't thank everyone in this room enough for the amazing, investment they've made in me. And my goal is to make them proud every single day. And these are just some fun pictures along the way, including I tried my best to get a Tom Brown stash, but it definitely looks better on him than it does me. And I think Tom Brown would also probably recognize that picture as well. But no, this was it was a great 5 years, and I just can't thank you all enough for the ways you've poured into me. And I'm happy to answer any questions if there are any. So thank you very much.
That was truly fantastic.
Thank you.
It was great to hear this. I'd heard about this talk before, but it was great to hear it in person. A point you made about people coming to see you because you're part of a system or health system. That's one of the biggest battles we have here. The administration thinks that if we put UVA Health on these 3 new hospitals in North Virginia, that patients are going to come there. And patients don't come to see a building. The brand means nothing. They come to see the nurses, the doctors, the APPs, staff, the personal relationships they develop. And in many ways, I think it's completely wrong. They've wasted money in many ways, because it's the people in the building.
Yep.
It's not the building and the sign on the building that means anything. And you just prove that point too, based on your experience. Patients come to see their doctors and the staff. They don't have relationship with the building. They don't have a relationship with the EVP or CEO or the
Mhm.
dean. They have a relationship with you.
Exactly.
So that's a really great point.
I agree. Thank you. Yeah, fair enough.
One that's the best, but worry.
Hmm.